Have you ever felt a sharp, nagging pain in your knee while running? You might have experienced what's commonly known as runner's knee. This condition is no stranger to runners and athletes alike, often manifesting as a persistent discomfort that could potentially hamper your fitness journey. But worry not, we're here to guide you through the complexities of runner's knee. In this video, expect a comprehensive step-by-step guide on managing and preventing this common ailment. Stay tuned for practical, easy-to-follow tips to keep your knees healthy and your running routine pain-free. Before we dive into prevention and management, it's important to understand what runner's knee is. So, let's get started. Runner's knee, also known as patellofemoral pain syndrome, is a broad term used to describe a variety of knee issues. These knee problems can cause a range of symptoms including pain, swelling, and even popping or grinding sensations. These symptoms are often due to a variety of causes such as overuse, strain, or injury. Now, this doesn't mean that only runners can experience this. Anyone who puts a lot of stress on their knees, be it athletes, manual laborers, or even those whose lifestyle involves a lot of knee-bending activities, can develop runner's knee. So, how do you know if you have runner's knee? Well, diagnosis typically involves a physical examination by a healthcare professional. They may ask you to perform certain movements to check for pain and assess the range of motion in your knee. In some cases, they may also use imaging tests like X-rays to get a better look at the structures of the knee and identify any possible damage. Recovery time from runner's knee can vary widely depending on the severity of your symptoms and your overall health. It's crucial to remember that rushing back into strenuous activities can do more harm than good. Instead, treatment usually involves a combination of rest, low-impact exercises, and in some cases physical therapy. It's also worth noting that while runner's knee can be uncomfortable and frustrating, it's usually manageable with the right approach. So don't let this condition discourage you from pursuing a healthier, more active lifestyle. Now that we understand more about runner's knee, we can explore effective ways to prevent and manage it. In our next segment, we'll delve into various prevention strategies that can help keep your knees healthy and strong. So stick around for more insights on your journey towards a fitter, stronger, and healthier you. Prevention is always better than cure. So, how can you prevent runner's knee? The first line of defense is a proper warm-up before running. This isn't just about a few quick stretches. We're talking about a full warm-up routine that raises your body temperature, increases blood flow to your muscles, and prepares your joints for the impact of running. This could include brisk walking, dynamic stretches, or light jogging. Remember, a well-warmed muscle is a happy muscle, and a happy muscle is less likely to get injured. Next up is regular strength training, especially for your lower body. Strong muscles are more resilient to stress, and they also provide better support for your joints. This doesn't mean you need to become a bodybuilder. Simple exercises like squats, lunges, and calf raises can go a long way in strengthening your legs and protecting your knees. Just make sure you're doing them correctly. Incorrect form can lead to injuries, so it's worth seeking advice from a fitness professional if you're unsure. Now let's talk about footwear. The right pair of running shoes can make a world of difference. They should provide ample cushioning to absorb the impact of your foot hitting the ground, and they should also offer good arch support. Everyone's feet are different, so it's important to find a pair that fits your foot type and running style. Don't be tempted to keep wearing your old favorites until they're falling apart. Running shoes have a lifespan, and using them beyond that can increase your risk of injury. Last but not least, maintaining a healthy weight can also help prevent runner's knee. Extra weight puts extra stress on your knees, and over time, this can lead to wear and tear. A balanced diet and regular exercise can help you maintain a healthy weight, but remember, it's not about being skinny. It's about being healthy. By following these prevention strategies, you can significantly reduce your risk of developing runner's knee. What if you're already experiencing runner's knee? Here's how you can manage it. First off, it's important to remember that rest is key. When you start feeling the telltale signs of runner's knee, pain, swelling, a popping or grinding sensation, it's time to hit the pause button on your training. This doesn't mean you have to stop exercising altogether, but it does mean you should take a break from high-impact activities that could exacerbate your symptoms. Now, while you're in rest mode, don't just sit around. Engage in low-impact exercises that can help strengthen your knees without putting too much strain on them. Swimming, cycling, and even walking can be good alternatives. The point is to keep moving, but in a way that allows your knees to recover. Speaking of recovery, it's crucial that you don't rush back into your usual routine. Avoiding a premature return to strenuous activities can mean the difference between a speedy recovery and prolonged pain. Listen to your body. If it's telling you it's not ready, then it's not ready. Patience, as they say, is a virtue. But what if your symptoms persist or become severe? Well, that's when it's time to seek medical advice. A healthcare professional can provide a proper diagnosis and recommend a treatment plan tailored to your specific needs. This could include physical therapy, medication, or even surgery in more serious cases. Remember, managing runner's knee is not just about treating the symptoms, but also about addressing the underlying issues. This might involve improving your running form, wearing the right shoes, or incorporating more knee-strengthening exercises into your routine. By taking a comprehensive approach to your recovery, you can ensure not only that your knee heals properly, but also that you're less likely to experience this issue in the future. With these management techniques, you can effectively deal with runner's knee and get back on track sooner. Did you know that your diet can also play a role in preventing and managing runner's knee? Yes, indeed. A well-balanced diet is a cornerstone of overall health and plays a crucial part in maintaining the health of your knees. Let's talk about the importance of a balanced diet. Eating a variety of foods from all food groups can ensure you're getting a broad spectrum of nutrients. This includes proteins for muscle repair and growth, carbohydrates for energy, and healthy fats for inflammation control. Also, let's not forget the vitamins and minerals that are essential for bone health and joint flexibility. Now, there are specific foods that are particularly beneficial for joint health. Foods rich in omega-3 fatty acids such as fatty fish, chia seeds, and flax seeds can help reduce inflammation. This is particularly useful for conditions like runner's knee, where inflammation can be a significant issue. Antioxidant-rich foods like berries, spinach, and nuts can help combat oxidative stress that can damage your joints. And foods high in vitamin D and calcium like dairy products and fortified cereals are essential for bone health. Remember to hydrate as well. Drinking plenty of water helps maintain the elasticity of the tissues around your joints and can aid in the prevention of joint-related issues. Remember, a healthy diet is a key component of a healthy lifestyle, and it can significantly contribute to preventing and managing runner's knee. So make sure to fill your plate with a colorful array of nutrient-dense foods. Your knees will thank you. Let's quickly recap what we've discussed today. We started by understanding what runner's knee is, also known as patellofemoral pain syndrome. It's a broad term that includes various knee problems causing pain, swelling, popping, or grinding sensations. Diagnosis involves a physical exam and possibly imaging tests like X-rays. The recovery time varies, and treatment includes rest, alternative low-impact exercises, and avoiding premature return to strenuous activities. We then moved on to prevention strategies. Remember, prevention is always better than cure. Incorporating low-impact exercises into your routine, taking adequate rest, and not rushing back to strenuous activities are all critical in preventing runner's knee. It's all about listening to your body and not pushing beyond its limits. Next, we delved into management techniques. If you're already experiencing runner's knee, don't worry. With rest, the right exercises, and patience, you can manage and eventually overcome this condition. Again, it's crucial to avoid rushing back into high-impact activities and to allow your body the time it needs to heal. We also discussed the importance of nutrition in maintaining knee health. A healthy diet rich in calcium and vitamin D can help strengthen your bones and muscles, including those in your knee. In conclusion, understanding, preventing, and managing runner's knee is a multifaceted approach. It requires listening to your body, taking proper precautions, managing the condition if it arises, and fueling your body with the right nutrients. If you found this information helpful, show your support by liking this video and subscribing to the channel for more valuable insights on your journey to a healthier and happier lifestyle. Remember, your health is your wealth.